Swatilekha, Assistant Professor. I am working in a nursing college. Today we will talk about qualities of good nurse, basically in hospital duty time. It is really very important to have some qualities which will basically help a nurse to be a good nurse. Anybody can be a nurse, but everybody will not be a good nurse. So there are some qualities there which we should maintain, which a nurse should maintain. So let's see what are the qualities. First quality of a good nurse: able to manage time. Now what is basically happening? Whenever a nurse is working in a hospital, he or she should maintain the time as per the duty schedule. Maybe it is a morning duty, maybe it is a evening duty, maybe it is a night duty. It is really very important to maintain the time, otherwise what will happen, the other staff is there, and if I am not able to maintain the time, so they also will be in trouble. We do not have only professional life, along with that we are having personal life. So if I will not go in time, I will not go and take the handover and take the responsibility of the patient, how the another staff will go. So to be a good nurse, it is really very important to maintain the time as per the duty schedule, though it is a morning duty, evening duty or night duty. Maybe it is a private hospital, maybe it is a government hospital. It is really very important to keep in mind this, maintain the time. Next point you are able to see, maintains hygiene, because whenever, though it is a government or it is a private, it is really very important for a nurse to maintain hygiene. They will enter into the ward, they will take charge of their patient, and before that they should hand wash. Whenever they will go to ward and they will start taking care of their patient, it is really very important to do the hand washing, because they are coming from outside, and if they are having something in their hand, especially this microorganism, dart or something like that, it should not be transferred to the patient. So it is really very important to maintain hand hygiene. Not only hygiene is really very needed, because if a nurse is not taking bath regularly and he or she is going to ward and then only doing his hand washing, so naturally that will not do anything, that will also create some problem. So it is really very important to maintain all over hygiene. And not only that, whenever working with patient, it is really very important, I hope you all know that it is really very important to maintain the hygiene, or especially hand hygiene, before procedure, after procedure, before touching patient, after touching patient, before going to toilet, after going to toilet. These are the things are really very important. Third point, you are able to see, particular about duty. Whenever I will know that I am having my morning duty, maybe I am a staff nurse, maybe I am a shift in charge, or maybe I am a sister in charge, whoever I am, I need to maintain my duty, because somebody will be there in the hospital, maybe they are my co-workers, maybe they are my patient, or maybe they are any another caregiver who is having some additional work with me, who is depending on me. So if I am not particular about my duty, then they also will be in trouble. So whatever duty I am having, I have to maintain my duty. I cannot deny that. I cannot be irresponsible. I need to be responsible for my duty. I need to maintain it. As a staff nurse, what are the procedures, what are the works I am having for my patient, I will perform that. As a sister in charge, as a shift in charge, what are the work I will have, I will maintain that. I cannot deny it. I cannot be so reluctant about it. I have to maintain it. Number 4, confident, not overconfident. Here one more thing is really very important. Now confident is really very important, otherwise other caregivers are there, patient is there, patient families are coming, doctors are coming, everybody is coming into the hospital depending on their need. So if I am not confident, they will also lose their confidence on me. So it is really very important to be confident, but I'm again saying not overconfident. So if I'll be overconfident, so naturally I will make mistake. And not only that, the other people also will lose their faith on me, that she doesn't know anything, he doesn't know anything, but very overconfident. So this is not needed. Be confident. How you can be confident? You increase your knowledge by studying books, you increase your skill by performing various types of procedures. If you don't know something, you don't try to show that you know that, you try to get it from your seniors or from your colleagues or doctor or through books. something like that. You just try to achieve it, you just try to be confident by increasing skill and knowledge. Without knowledge and skill, nobody can be confident. So keeping that in mind. So be confident but not overconfident. Next one, we are able to see facial expression according to the situation. So various places you are able to hear that everybody is saying nurses should have a smiling face. Yes, that can be true, but I will say one thing, it is not possible that in hospital every situation is a situation when you can smile, isn't it? The patient is in sorrow, patient is in depression, patient is crying, patient knows already that she is or he is going to die. So in that situation, naturally you cannot smile. So that is why I'm saying facial expression according to the situation. So whenever they are in happy mood, you can also smile little bit. Whenever they're in depression or whenever they are in some problem or something like that, you try to feel that situation and you try to help your patient, and automatically your expression will come. It is not like that you are doing some drama, you are doing something like that to show your or make your facial expression like that. So basically you just try to feel that patient situation and automatically your facial expression will come. Sometimes it can happen that you don't like that patient or you don't want to be in that particular situation, so your facial expression is not becoming according to the situation. It also can happen. That is why I'm saying try to know the situation, that depending on the situation, try to feel the patient situation, automatically your facial expression will be like that one only. Don't be too soft, don't be too rude, and don't always smile, and don't always be too much timid and stone like face. Okay, so next we are able to see ready to learn. Yes, it is really very important for a nurse to be ready to learn always. Whenever you are in a clinical situation as a staff nurse, as a shift in charge, as a sister in charge, or in charge, ward in charge, whoever you are, it is really very important to learn. You can learn from another colleague, you can learn from another caregiver, you can learn from doctor, you can learn from patient also on various other things. So it is really very important to learn something. So if you are very reluctant to learn something, so what will happen? Like they will think that, oh my god, she is like being so arrogant and he is being so arrogant and rude, but still they don't know. So it is not possible that we will know everything. It is possible that we don't know this thing. So this is the thing, to be a good nurse, it is really very important. Be always ready to learn something new from another person. And next we are able to see respect for own profession, have responsibility to maintain it. Yes, it is really very important, because as we are nurse, we are in nursing profession, so it is really very important to give respect to our own profession. Never utter any bad word in front of any another person who is not a nursing personnel. Okay, so basically what I am trying to say, whenever you are in a situation and maybe 2 of nurse or 3 of nurse or some nurses are having some conversation or using some bad sentences or bad languages, please try to stop all those things, try to avoid all those things, because it is really very important to maintain your own dignity. Sometimes it can happen that there is always a problem between GNM nurses and B.Sc nurses. They are blaming them, so all these things are happening. If something is there, just keep it aside. Do not show any this type of thing in front of any another personnel or any another person in the hospital, otherwise they will get chance to tell something on the name of nurses, which is not essential, which is not needed. Always have your respect for your own profession. You are a nurse, you has come to nursing profession, it is a noble profession. And not only that, if I'll leave the noble one also, it is a profession where you are giving the care to the patient. Sometimes you are giving care to them, that is why they are become cured. Obviously doctor's prescription is there, doctor's surgery is there, all those things are there, but keep in mind, if we are not there, if we will not be there, so who will take care of the patient, isn't it? So always have respect for your profession. And as you are having the respect, the responsibilities you are having, the time you are having in your duty, the work you will have for your patient, the procedures you will have for your patient, the other related work you will have in the hospital, trying to maintain all those things with your responsibility. So nothing will be missed, nothing will be damaged, nothing will not be taken care of. All the things you are having in your hospital as a staff nurse, as a shift in charge, or nursing educator, or clinical trainer, whoever you are, whenever you are working in hospital, that time try to maintain all of your work within your scheduled time, because you have to take the responsibility of being a nurse. So I hope these qualities which I felt that it is really very important for a nurse to maintain to be a good nurse. So if you are a clinical nurse, if you are working in hospitals, try to maintain all these qualities. Maybe sometimes it will not be possible, or it will be felt like very tough, but still I will say that if you'll try to maintain it, at least 80% you will be able to maintain it. So if you like this video, please don't forget to like, share and comment, and obviously subscribe. Don't forget to press that bell icon, and thank you for watching.